The lymph nodes in the neck are categorized into levels 1 to 7 based on their anatomical location and drainage patterns. This classification is widely used in head and neck oncology to guide diagnostic and therapeutic approaches. Below is a detailed description of the lymph node levels, their anatomical boundaries, and drainage areas. Level 1, submental and submandibular nodes. Boundaries. Level 1A, submental. Superior mandibular symphysis, inferior, hyoid bone, lateral, anterior belly of the digastric muscles. Level 9B, submandibular. Superior, body of the mandible, inferior, hyoid bone, medial, anterior belly of the digastric muscle, lateral, posterior belly of the digastric muscle and the stylohyoid muscle. Drainage areas. IA, tip of the tongue, anterior floor of the mouth, mandibular incisors, lower lip, and skin of the chin. IB, lips, cheeks, body of the tongue, anterior hard palate, and submandibular and sublingual glands. Level 2, upper jugular nodes. Boundaries. Superior, skull base, inferior, hyoid bone, medial, lateral border of the sternohyoid muscle, lateral, posterior border of the sternocleidomastoid muscle. Divided into 2A, medial to the spinal accessory nerve, UB, lateral or posterior to the spinal accessory nerve. Drainage areas. Oropharynx, parotid gland, posterior tongue, nasopharynx, hypopharynx, and posterior nasal cavity. Level 3, midjugular nodes. Boundaries. Superior, hyoid bone, inferior, cricoid cartilage, medial, lateral border of the sternohyoid muscle, lateral, posterior border of the SCM muscle. Drainage areas. Hypopharynx, larynx, thyroid gland, esophagus, and submandibular area. Level 4, lower jugular nodes. Superior, cricoid cartilage, inferior, clavicle, medial, lateral border of the sternohyoid muscle, lateral, posterior border of the SCM muscle. Drainage areas. Hypopharynx, thyroid gland, subglottic larynx, esophagus, and thoracic duct. Level V, posterior triangle nodes. Boundaries. Superior, skull base, inferior, clavicle, anterior, posterior border of the SCM muscle, posterior, anterior border of the trapezius muscle. Subdivided into VA, superior to the cricoid cartilage, VB, inferior to the cricoid cartilage. Drainage areas. Scalp, nasopharynx, oropharynx, thyroid gland, and posterior skin of the neck. Level 6, anterior central compartment nodes. Boundaries. Superior hyoid bone, inferior suprasternal notch, lateral, medial borders of the carotid sheaths. Drainage areas. Thyroid gland larynx, glottic and subglottic regions, trachea, and esophagus. Level sept, superior mediastinal nodes. Boundaries. Superior, suprasternal notch, inferior, brachiocephalic vein, lateral, medial borders of the carotid sheaths. Drainage areas. Thyroid gland, esophagus, trachea, and upper mediastinum. Additional notes. Virchow's node, located in the left supraclavicular area, level 4, it is often associated with metastatic abdominal malignancies. This classification helps in planning neck dissections and staging head and neck cancers.